afternoon, good evening, everyone, and welcome to the Cities on the Frontline Speakers Series session on climate, health, and equity. I'm Malcolm Robinson Campbell, Manager for Programs and Engagement here at the Resilient Cities Network, and I'll be co-hosting our conversation today with Dr. Jeanette Ikovics, the Samuel and Lissolette Herman Professor of Social and Behavioral Sciences at the Yale School of Public Health. During today's session, we will focus on critical challenges at the intersection of climate and health, while diving into the innovative and equitable approaches that cities are taking to build climate and health resilience. We will hear from Cape Town and Surat on how they are prioritizing integrative initiatives at the local level. We will also hear from Bear on the critical role that the private sector plays in providing the tools, knowledge, investment, and partnerships that cities require to build climate and health resilience. Today's session draws inspiration from our ongoing Urban Pulse Scoping program, which leverages research and knowledge exchange to highlight the urgency and importance of incorporating health and health equity into the global climate agenda at the urban level. Cities on the Front Line is a virtual thought leadership speaker series featuring solutions by cities for cities. It began in 2020 through a partnership between the Resilient Cities Network and the World Bank Group's City Resilience Program. This series provides cities, practitioners, and industries and residents they support with a platform for knowledge exchange. Before we start, let me remind everyone of the intentions of this speaker series and the ground rules for the conversation today. The purpose of these global seminars is to have an open and honest learning conversation. We ask you not to attribute any comments unless you have the person's express permission to do so. We can help you obtain this permission if needed. We have about 700 registered participants for the call today. So to facilitate the discussion, we ask you to write your questions on the Q&A function on Zoom. We also welcome you to introduce yourself over the chat function, please. Please note that the recording of the session, as well as the summary of the presentation material, will be posted online on the Resilient Cities Network website. I will now hand over to Jeanette, who is not only co-hosting this session, but is also co-leads our Urban Pulse Scoping program. It's a pleasure to have you here. Jeanette, over to you.
Thank you, Malcolm, and welcome, everyone. It's my pleasure to be here and to be with all of you to talk about a real that is Urban Pulse and working at the intersection of climate, health, and equity to promote resilience. The climate crisis is a health and equity crisis. The climate crisis threatens our food, water, and air, escalates extreme weather and climate events, and it puts our physical, mental, and social well-being at risk. It's an urgent and accelerating threat, outpacing predictions and placing immense strain on communities all over the world. But cities, especially in developing nations who have fragile health infrastructures, face challenges to respond. And yet, amidst these challenges, action at the intersection of climate and health offers potential for substantial co-benefits. We have been working together, that is Yale University and Resilient Cities Network, with support from the Rockefeller Foundation, to launch Urban Pulse last year in Dubai at COP28. And there and here we reiterate that you all sitting in cities, working in cities, living in cities, are on the front line to protect our communities from the effects of the climate crisis. Solutions that promote health equity and climate resilience have the power to save lives and the livelihoods of millions. And we have been working together to bring cities and urban practitioners together to help expedite action. And we invite all of you, if you are not already connected, to join us. I'm going to take a few minutes this morning before turning over to our speakers to present results, just of some results from a mixed method study that we have been conducting this year. I want to, if some of you on here were respondents, I want to thank you. And for all of you, I want to let you know that a full report is forthcoming later this summer. So we did city surveys we had 191 respondents. These were drawn from a convenient sample of the Resilient Cities Network, C40, and Climate X Health. These 191 respondents represent 118 cities presented here in the map. And this was from 52 countries around the world. In addition, we did a set of deep dive stakeholder interviews in Africa, Asia, and Latin America. And some of the key findings probably will not surprise you, but I think they're very important to drive our action forward and to bring, as I like to say. So the majority of cities recognize the severe climate threats, such as and flooding, which many of us are experiencing right now, together with air pollution from forest fires, from industry and agriculture, and the consequent threats they pose for health. However, cities said they're not prepared. When asked on a scale of 0 to 100%, how ready is your city for these climate threats? The average was about 42%. Moreover, only 20% have a climate resilience plan or other tool that integrates climate and health. And I think this is really important. And with each of these concerns that I have, I'll say provides an opportunity. So given that only about 1 in 4 have a climate resilience plan or other tool that integrates climate and health, we have a great upside potential for other cities to create better readiness by thinking about health in their climate preparation. Now, many cities identified vulnerable populations, and we'll hear about some of these. And of course, children, older adults, those living in informal settlements, migrants, outdoor workers. But when asked, who are you most concerned about? The majority of cities said children. Nearly all respondents reported transitioning to a zero carbon economy. That was 88%, said that this would create economic opportunities and benefits for residents. Facet and asset is that political and community engagement at the nexus of climate, health, and equity is underway, and cities are interested to identify, implement, and amplify solutions. Now, we also did a thematic analysis of 300 comments that were typed into the survey. These were open-ended questions in the survey. And the solutions that you collectively articulated, the top 10 are these. And again, we'll hear about some of these from our distinguished speakers today. But greening interventions were most often mentioned, followed by health-related interventions, data infrastructure and disaster management, public awareness, community engagement, then and water and transportation. We have heat mitigation, food systems, and clean energy. So there are many, many sectors working, frankly, individually, but also collectively to address climate, health, and equity. So it's time for action now. We do have the resources, technology, and evidence to cultivate communities where everyone enjoys good health, well-being, and shared prosperity without harming our planet. And of course, not only is this called Cities on the Front Line, many of you are on the front line already implementing solutions for a better future. And the work that you do and we do will have co-benefits for climate and health. So I'm going to turn it over now to our distinguished speakers. Rodrigo Oria, the head of Public Affairs, Science, and Sustainability from Bayer in Mexico, will take the stage in about 10 seconds. And he will be followed by Albert Ferreira, the lead for strategy implementation from Cape Town, Dr. Vikas Desai, the technical director of Urban Health and Climate Resilience Center of Excellence in Surat, and Jack Fisher from Market Access, Public Affairs, and Consumer Health will end with some insights. Thank you. Rodrigo, please take it away.
Thank you, Janet. Good morning, good evening, and good night to everyone. It's a pleasure being here. So I have a very quick presentation I'm going to share with you, talk a little bit about what we are doing in Bayer to face these important challenges regarding the link between climate change and health. So, well, first, Janet already talked about this. There's no doubt that climate change is one of the biggest biggest public health threat of our time. So it does not only have environmental effects, but also it is affecting now the public health systems in all over the world. So we at Bayer are working very hard to understand and to decrease the effects, especially in some of the areas of our expertise as a company. So a little bit more deeply on what we are working on in Bayer regarding climate health. Of course, we are working a lot within our value chain to decrease the impact of our operations all over the world, reducing CO2 throughout the value chain. We also have a very significant contribution in helping ensuring food security in the face of this changing climate and longer periods of drought and floods and all the severe weather events we are facing. We have to make sure that we have a resilient agricultural system that can ensure enough food for everyone in the world. And of course, working on health equity, on how we can ensure that everyone all over the world in different cities and rural communities can have access to basic health systems. Sadly, what we are seeing is that, especially in developing countries, the gap between access to food, access to health has been increasing. So we are working very hard to provide technology, new products, new services to help health providers, cities, farmers all over the world to ensure that everyone has enough food and everyone has access to health. So this brings to life our mission as a company. We are working to achieve a world where there is health for all and hunger for none. So just a few examples of 3 areas of focus of important health aspects that we are seeing related to climate change. The first is the effect that longer periods of heat and more extreme heat events all over the world can have on cardiovascular health. As you can see on the slide, it has been shown that the frequency of these extreme heat events is on the rise, and with that we are seeing more heart attacks, cardiovascular events in general. And as a leading pharmaceutical company in cardiovascular health, we are working with new companies, developing technologies and partnering with cities in the United States, in Saudi Arabia, and launching to other countries. So for instance, you can see here in the slide, we have a partnership with Huma to develop technologies accessible to everyone through a smartphone, so that they can have better information of their own cardiovascular health, the areas of the vulnerabilities, that they might be facing, and they can have better information to identify early alert signals, and they can prevent severe cardiovascular events. So that is one of the areas we are working on. Another one is allergies, along with increasing climate and temperatures all over the world. We have been seeing more frost-free periods in different cities. So cities where you used to have very severe winters where the snow covered everything and basically stopped the growth of many plants. Now we are seeing less snow, more plants, more growing seasons in agricultural zones. So of course more pollen, and this also affects the allergies of people all over the world. So we are working with cities to understand these new patterns, what types of pollen and what types of allergies are affecting different people, and also empowering people to ensure that they have control over their allergies by having the right products and information to use these products in a safe manner. And the third area of focus is chronic kidney disease. This also relates to increasing temperatures all over the world, and how this increased temperature affects the functioning of the kidneys. We are also working to understand people that might be in more vulnerable situations. So for instance, studies have shown that people that work outdoors, such as farmers, for instance, smallholder farmers, importantly, but also firemen and construction workers that are working outside in these hot conditions, how this working situation is affecting their kidneys, and how we can adapt the services and the healthcare that these people need in order to ensure a well-functioning kidney system. So this is just a very broad overview of examples of things we are working on at a global level. But I also wanted to touch a little bit on how we are trying to make these technologies and this information available to cities all over the world. And I want to talk a little bit of my experience working from Mexico. What we are doing all over the world is partnering with local authorities, so with city governments, but also other stakeholders, other companies, NGOs, the academia, to try and address these issues of climate change at the local level. Of course, as I'm sure most of you can relate, the cities in Mexico City, where I live in, and other cities, the main issues we are facing is water availability. It's a big problem all over the world, and especially in countries like Mexico. Of course, we have cities like Mexico City that have relevant air pollution problems. And all over the country, and also Jeanette mentioned a little bit about this, there is, we don't have a very strong public health system that provides access to health to everyone, regardless of their employment status or economic status. So part of these collaborations that we are seeking to develop at the city level have to do with, first, mitigating the impacts. And of course, we do a lot of environmental work, like promotes bicycle commuting, reforestation and cleaning brigades, and things to mitigate climate change or its effects. But also we are working a lot on promoting self-care and health literacy with things like webinars, talks, taking information to people about diseases. For instance, you can see here in the slide, we did a lot of work during the COVID pandemic to make sure that everyone had more access to what was happening with this disease, how to prevent it, how to regain health, and of course also providing donations and supporting cities with equipment, materials, and medication they need to provide services to the people that live in their cities. So this is just a very broad overview, and I'll send it back to, I guess, Malcolm. Thank you, Malcolm.
Thank you, Rodrigo, for this wonderful presentation and for articulating the effects of climate change on health and the actions that Bayer is taking. We've seen that there's a growing recognition of the importance of this topic in the public sector, as evidenced by the UAE Declaration on Climate and Health, signed by over 140 countries. But cities around the world are also taking action. We have Surat and Cape Town here to share their experiences. Both are active participants in the Urban Pulse program, and I want them to tell us more. So Albert, can you elaborate a little bit about how Cape Town's urban health program addresses this interconnection?
Great, thank you, and I trust you can hear me. So the urban health program in the city, and I'll elaborate in a moment in the presentation, really aims to identify the spatial distribution of health inequalities across our city, understanding that within the developing world context, of course, we deal with significant inequalities, urban slums, etc., and working out from that basis how to respond to inequalities and empower communities to be resilient to shocks and stresses. And of course, the impact of climate change being one of those impacts. We believe in the City of Cape Town that it's not necessary that we need standalone interventions to address climate, health, or inequality for that matter. And as an example of that is the energy access or energy poverty experience in the city, where we stem to address energy poverty directly because of the health outcomes that are associated with it, be it exposure to heat and cold, open flames that risk structural fires, respiratory and pulmonary diseases, etc. And an example of that, working with the Resilient Cities Network and our energy colleagues, is to explore energy access hubs in unelectrified communities, and it's by working together across health, climate, and equity concerns that we are able to address these sort of triple concerns that are on within the City of Cape Town and other developing cities around the world.
Thank you, Albert, for this presentation. I will now hand over to Dr. Vikas Desai from Surat. Dr. Desai, can you please provide an overview of the amazing work that you guys have been doing in Surat? We've heard a little bit about that within the Urban Pulse program, in particular, the work of the Urban Health and Climate Resilience Center for Excellence.
The urban health is a new arena for my country. We were focusing more and more on rural health services because we were 80% rural in India. Suddenly we realized that in country that we are urbanizing very rapidly and we need to focus on urban health, and came the climate and urban health is even newer than that, because it has come up for action. Now, City of Surat is located on seashore, as well as the river crosses the entire breadth of the city, and then this situation is otherwise very pleasant, but with climate change, it is increasing the risk of floods, it is increasing the risk of temperature, humidity, and so on. So city is developing very fast. Can I have a next slide, please? Okay, city is expanding very fast. We get a lot of migration in the city, and that migration is from other parts of my own state or from other states of the country. And because of migration, we have expanded our city limits also by merging the peripheral rural area with us. And that's how the city is getting bigger and bigger. And we have reached to 8 million population, where we have 60% of migrants poor to rich, but predominantly poor, and slums, 30% population is in slum, which also has 80% migrant population. So we have to deal with the socio-demographic crisis as well as the public health crisis. And city has suffered enough, I can say, due to the rise in population. As and when the population increases in a decade, the new health problem arises in the city, and we take care of it. But it breaks down, and it creates a problem, as well as with that, we also face a problem of managing the issues. Next, please. Next slide, please. Okay. As UHCRCE, we work on various aspects. We had several workshops, and we also had a work done for the public health vulnerability assessment, public health and climate vulnerability assessment of the city, spatial assessment. And what has come up is, I would like to put more emphasis on integrated urban planning, and community participation has emerged as a major need. Health service network has emerged as a major need, but the topmost need, but now it has been taken care of by the national program, National Urban Health Mission. So if I conduct a workshop now, then it will probably change the scenario. Then we have a network analysis done with the in workshop with the in presence of Arup organization, where the migrants are the migration is the major threat to the city comfort. And then comes the multi-indicator survey, which we brings out the spatial variations in the vulnerability of the city. Next, please. Next slide, please. Okay, this is what city was in 1951, immediately after independence. We were 2 lakh people in the city with food, finance, floods, filthiness, filariasis as our identity, and gold and silver trade was our trade in the city. But then came the era where our population increased because of lot of migration in the city. The area also is increased, and the food remains still a popular thing for the country. Finance, floods, we are the economic hub of the state. And now the infections which we are dealing with mainly is dengue and non-communicable disease. The pandemic is managed by all. We are now known as Bridge City, Clean City, Green City, Safe City. So all physical things which for climate resilience have happened, but its impact on health is not much perceived by the people. Next, please. We have a active municipal corporation, local self-government, which is the one of the oldest local self-government in the country. And we have several achievements, including 30% population in slum and slum-like area, 60 to 80 I have already talked about. And every year 76,000 newborns are added to the city population. Next, please. Next, please. Okay, these are this is our major challenge. These are our climate threats, which includes sea level rise, which includes the cyclones, flooding. We have experienced 25 floods in last century. Last was in 2006, last major river flood. We do get regularly the creek floods also, but that severity is restricted to certain zone only. But river flood affects the entire city. And this is our climatic situation. Weather of 23, we shows 40-degree highest temperature recorded, and 65% of the humidity reported, and rainfall. All this I'm talking about because this was the force behind creating an Urban Health and Climate Resilience Center of Excellence. Next, please. City has done a wonderful job. And then came the era of Urban Health and Climate Resilience Center of Excellence. It was first of its kind initiative in India, where municipal corporation has settled down the trust, and commissioner of the corporation is the chairperson. It's public-private partnership trust. Though as health is a part of it, it is more private practitioners associations. It also has a government officers and local NGOs and other people as trustees. The goal is healthy citizens in healthier city. Our filthiness was one of the major concerns in 1994, but now we are cleanest city, and every citizen expects the city to be maintained like that by Surat Municipal Corporation. What we do is we do research for evidence-based, to create evidence for the decision makers to act on, training, networking, and advocacy. Jurisdiction is Surat and any city of India. Next, please. How do our work is converted into policy? We share the research and reports with the authorities. We go for multi-stakeholder dissemination meetings. We pilot and demonstrate the models. We do the advocacy with the city network partners. We disseminate training of multi-stakeholder service providers. Research-based articles we publish. We also organize community events for community education, and we dissemination in meetings of the municipal corporations of the state so that it reaches up to state. Next, please. Okay, these are some of the lessons which we have learned. Though we were registered in 2017, we started working in 2010 on climate and health. And probably in ASEAN 10 cities, we were the only city with the health focus, public health focus in the activities. We talk, we research, and we train for the urban health and climate together, because what is not good for health is not good for climate. And the cutoff of the safety varies from city to city depending upon the situation, and that's why the city needs to focus on that. So health is one of the outcome. Climate change is most appealing for health impact of climate change is most appealing for advocacy. For health and climate resilience, the city needs all specialists. This I would put emphasis more on. It needs most urban practitioners who are expert in their own domain, but they understand the other domains, and they have a capacity to cross the barriers. Next, please. Every city is different, and climate and health is not static. So we need a regular monitoring, evidence-based action as and when the situation arises, and do the advocacy also. So this needs local stakeholders team. It can be initiated as one project by some experts guiding the team, but then team need to build up its capacity to work on and to participate and to follow up the situation. And institution like UHCRCE is one of the mechanism to do that. Next, please. I would say our strength of UHCRCE is the cooperation from municipal corporation, initiative taken by municipal corporation, funded projects which we are getting to sustain. And I would also add that somebody who knows the city well and the events of health and climate in the city well is very important for the city. Our weakness is we are fund dependent. That means project fund dependent. Corporation is not spending money for that. And second is that we need to, our corporation office is very busy otherwise, and that's why there is also a situation where the national guidelines and state level guidelines are given to municipal corporation, but the implementation should be as per the local need, and that's where the major challenge lies. So we need learners and doers cooperation, and the city is full of academic institutions. So there's no dearth of learners. Only thing is they need now to start working on climate and health both. Thank you. Thank you for listening.
Thank you, Dr. Desai, for this very informative presentation. As we know, local level actions are very important. After his introduction, I'll hand it back over to Albert, who will now go into further depth about the actions that are being taken in Cape Town.
Great, thank you so much. And thank you, Dr. Desai, for your presentation. I hope that I can touch on some of the topics that you also addressed, particularly within the developing world context that we are in. So this is just a short presentation around the cities of Cape Town's approach to integrating health. And I'll mention the intersections between climate change and equity as well. So just a bit of background, of course, during COVID-19 and in terms of health in general, urban poor and vulnerable, face the biggest health risks. And, this strongly enforces already what most research knows that healthcare itself plays a relatively small role in overall healthcare if we consider determinants of health, where social determinants of health has often a much larger impact. And it is through local governments like the City of Cape Town and elsewhere that we can improve health outcomes through either direct healthcare or through the environments that influence health. So this presentation will just touch on our approach over the past few years. So I'm not going to touch on this slide too much. This was brought up earlier, but just to say that there's strong evidence around the link between climate change and health risks. And just to mention that climate change impacts fundamentally the underlying social determinants of health, and of course also puts pressure on health systems. And from the City of Cape Town's perspective, it's really focusing on reducing vulnerability, because climate change has this vicious cycle impact where already vulnerable communities face disproportionate impact of climate change, and which of course impacts their health and which requires a transversal approach. So what is important to understand from Cape Town perspective is that we want to learn from crisis. So be it from COVID-19 or the broad devastating drought that Cape Town faced a few years ago, where the municipal water supply nearly ran out. Some people might know that as the day zero that we were approaching. And through learning from crisis, we've understand fundamentally that poverty and inequality drives vulnerability of community, and that sustained action is required. That these complex and wicked problems require collaboration, coordination. It requires community bottom-up involvement. And then from a health perspective, we really do need to address the chronic disease burden and crisis that's within our society, focusing on decentralized healthcare as well. And use of real-time data to monitor and respond was really important throughout these crises. So in terms of what we've done since COVID-19, so within the city's primary strategic document called the Integrated Development Plan, we have introduced for the first time an integrated health program, of which we have a specific initiative called the Urban Health Monitoring Initiative. So it has a few components which we have progressed on. So starting from the one end around the developmental phase is to develop a conceptual framework to identify and prioritize the various social determinants of health, and I'll touch on that in a moment, to then determine what is the relative health impacts of those, understanding fundamentally what functions the city provides and has authority over, and focusing on and how we can influence health otherwise. And then mapping certain indicators as well as the programs and projects that the city are already rolling out in that regard. And then finally, in terms of assessment and analysis, piloting a set of indicators required to monitor. And then we can also track historical data to see if what our current state of urban health is within this space. So if we move to the conceptual urban framework, so just to introduce the concept first, so you might be aware of this overall structure. So this is social determinants of health, but this idea of nested systems that impact individuals' health. So from individuals through to households, the communities in which people live, and then larger contexts and conditions, including climate change. So if we look at the conceptual framework that was developed, and this was utilizing existing frameworks around the world and local experience as well. So from direct and proximal health impacts on the one hand to more indirect or distal impacts, from downstream impacts and factors to upstream impacts. So if you can see from the individual level, we have direct health impacts such as chronic illness status, mental health, to more distal factors such as early childhood development, etc. At a household level, access to services, and neighborhood level, other elements around whether there's green space availability, spatial planning and other elements, policy, and then ultimately climate change. And what's important to recognize from a climate change perspective here is that climate change vulnerability starts playing out in the other domains and starts impacting in a cascading way down into the other spheres of influence around health of individuals and communities. And thus, we really do need to prioritize where to act. And within these different factors that were identified, the city has various levels of control. So, of course, those aspects that we have direct control over, we need to monitor, track and improve as we go, but also it becomes an advocacy approach for the city to advocate for firstly community action, but also working with other spheres of government, etc., to reduce overall vulnerability. So built on these different factors, we have indicators that are associated with them, and these are not theoretical indicators. They are indicators that exist already in practice and connected to city programs, so we are able to track what we are doing currently and recognizing what our impacts potentially on overall health. So you'll see there are different indicators by type, and just to mention, there was a set of around 600 indicators which was narrowed down accordingly. So from environmental factors, which include climate change and other factors, urban infrastructure, human settlements, health, etc., we developed this approach. And just to say, we're on a journey to improve indicators, moving from input indicators to more impact indicators over time. An example of collaboration within this case is around heat action within the city. The city has developed a heat action plan, and we have also assessed the health sector's capacity to respond. Communication and training and capacity is really important, and as well as implementing the city's climate action plan in this regard. So in terms of the next steps and moving forward, what is going to be important is health and climate in all policies and all relevant policies that might be. What is important based on the monitoring that we are doing is influencing planning, infrastructure development and prioritization to reduce vulnerability and improve climate response and health over time. And then conducting more direct research to monitor emerging health and climate risks. And this is all built on, really improving data systems within the city so we can understand where there are certain sort of health impacts, climate impacts, etc., and how that changes over time, locating people that are at risk, and then providing relevant analysis and implementing accordingly within those places of vulnerability. And this is a journey, of course, and we really welcome this partnership with Resilient Cities, and we look forward to working with this group. Thank you so much.
Thank you very much, Albert, for this wonderful presentation. So the experiences that you shared, including the framework and the monitoring initiative, have proved very valuable for us in our research and our reports, and we're hopeful that through this research, this type of initiative can be amplified and perhaps lead to a growth in interest, but also lead to more cities implementing such actions. We want to move over to the Q&A portion of the event. So the first question that we have is, this is for the entire panel, whomever believes they have an answer for it. What are the major differences you see in health systems in the last couple of years? or what lessons were learned, and how are you integrating these lessons into ongoing efforts to enhance health resilience in the face of climate change? Please, Albert, or Dr. Desai. Anyone want to take a crack at this question?
Dr. Desai, health systems, where are we? Certainly a lot of challenges that have resulted from more extreme climate. How do you think health systems are responding in Surat, but also what do you see from your colleagues around the world?
Health system are responding to the climate. Now climate focus is there in public health services. Health systems are responding to it, but then we don't train the future generation of urban planners with the idea of converging and to become urban health practitioners or urban practitioners, sorry. And that is one of the limitations. So you have to prepare them, send them message, send them reminder to work on the climate issues.
Yeah,
but it is already there in focus.
Yeah, in fact, even in the United States, climate is not part of a medical school curriculum, for example. Albert, I saw you nodding your head. What would you like to add here?
Yes, thank you so much. And again, I think the intersectoral approach that Dr. Desai brought up is really critical beyond the health system, how that impacts. But I will just say in Cape Town's context, the importance of community-based care came out quite strongly. We were forced to decant certain services from our health facilities. And what it actually opened up is uncovering people that might have not been seen by the health service. Noting that there were issues during COVID-19, and a lot of that has been taken forward in health practice within the city. And lastly, I will just add the importance of environmental health services also came out really strongly throughout the last few years.
And Albert, while I have you kind of on the stage, there's a question from an audience member asking if there's a link to the indicators database.
Thank you for the question. Yes, so the indicators that we used for the most part is publicly available indicators for the city of Cape Town. I'm happy to just quickly look at the links. So it's publicly available indicators. Which is useful in this case because it can hold the city accountable. But over time, we would like to present the curated indicator set into the public as well. I will share the link. Thank you.
Thank you. And I'll throw one more in. How can we cultivate, you all spoke about collaboration, how can we cultivate more multi-sector engagement and more multi-city engagement? There is a question from the audience about thinking about scaling up. I think it was extraordinary to hear Rodrigo, Dr. Desai, and Albert talk about Latin America, Asia, and Africa, and the incredible work in your individual cities. But how can we promote more multi-sector engagement within cities and more multi-city engagement for global scale-up?
I think we need to plan for long-term and short-term. So long-term is to give opportunity to pre-service group to realize that multi-sector convergence is the solution and is going to help them for their own domain. And for that, maybe we had one experiment of organizing a workshop of postgraduate students of all different specialities which can contribute as urban practitioners to the city. And they realized that working together helps them better than working in isolation. That is one. But it's a fact that in emergency, the convergence takes place, intersectoral convergence in system. but in routine, it's very difficult to sustain the intersectoral convergence. That is the reality. But if we prepare the future generation, maybe the scenario may be different.
Thank you, Dr. Desai. I want to bring Jack and Rodrigo into the conversation. We heard from Bayer that there are some local actions being taken around the world, in particular in Mexico. I just want to know, piggybacking off of this question, how is Bayer approaching building these connections with local stakeholders, in particular with local government? Is there a systemic approach to engaging local governments and local stakeholders?
So a little bit of my experience, but also what we are doing globally as a country is, Dr. Surat mentioned that no two cities are the same, so we need sort of to adapt the approach to every city. What we are trying to do is establishing, we call them community advisory panels in cities, especially where we have large operations. Where we identify the right stakeholders, the needs for that particular city, and then we develop like an action plan with all those stakeholders for each city. So there really is no one size fits all. Of course, as a multinational company, there are some resources that we can share, and we have collaboration tools internally to use best practices of what our colleagues are doing in other regions of the world. But really, I think what's most important is developing those connections at the local level so we can adapt accordingly.
And maybe just to add to that, Rodrigo, as well, looking at the global level, we know that Bayer is not the only company who's looking to explore our own role in supporting the climate and health agenda. So we've also participated in a range of different forums and platforms, especially when it comes to cross-industry collaboration as well. And I think often also wanting to avoid the pilotitis, if you like, of single interventions or single projects set up by small groups of actors. So really trying to pull all of our resources, experiences, networks together in that collaborative spirit as well. I'll stop there. Thanks.
And maybe we can ask one final question from the audience. We know that chronic disease is a growing burden on health systems. How, both from the private sector and from the city perspective, how are we seeing that addressing this chronic disease burden? How is this a foundation of building urban resilience in your specific context, in your areas?
Maybe if I can, what is in South Africa and in Cape Town, for that matter, a foundational issue is urban poverty and creating jobs. Chronic illness and burden of disease impacts fundamentally the ability of people to contribute productively to society. And as I've explained, as Dr. Desai also showed, the conditions and people's material conditions impacts their health as well, and their ability to respond to climate impact. So it's critical that we address the underlying chronic diseases within our societies.
Wonderful. Wonderful.
Government have introduced the insurance scheme for urban poor. They have also introduced the guidelines for the climate resilience in the city. And they have also introduced under public health program, a early screening of the health of the people, more focusing on urban poor. So I think that these three combinations probably will help us, and time will tell us whether it works and gives us a result or not.
Yeah. Thank you all so much. Let's turn it over to Jack Fisher for some closing remarks. You've got quite a task at bringing so many diverse and important ideas together, but I know that you can do it given your extraordinary background in the public and the private sector.
Thank you so much, Jen. And yeah, we are truly grateful for the opportunity to provide some forward-facing reflections to begin concluding today's session. It's important to really underscore that the impacts of climate change on health are being felt directly and indirectly around the world today and will likely only worsen. Earlier this week, the World Economic Forum released a new report highlighting 195 high-impact intersections where climate change is more likely to cause severe health impacts. The challenge is significant, and as we touched upon today, it will require us all to work together if we are to solve it. If we are to be successful, climate change and its health impacts must be at the center of corporate strategies and political agendas. As Malcolm touched upon earlier, at COP28, we saw a great triumph, with more than 120 countries signing the first climate and health declaration. Looking ahead to COP29 in Azerbaijan, we're hearing concerns from the health community that health may not have a prominent role in this year's discussions. Therefore, cities and mayors are crucial in ensuring that the health risks created by climate change are not only present, but seen as a multi-sectoral component of many of those future discussions. However, it's important to note that we all have a role in the response. Bayer, like many companies in our industry, has a rich history in partnerships of various forms, including private-public partnerships. Therefore, Bayer is ready to leverage our technical knowledge, networks, products, and resources to be part of that multi-stakeholder response to address this global health challenge. And finally, to ensure we are successful in the future, we really must learn from past lessons and experiences. This includes listening and learning from local communities on what their needs are and what contextual solutions are best for them. As such, we look forward to learning from your citizens on what their lived experiences on this topic to ensure their voices are heard, meaningfully included, and driving solutions going forward. So again, thank you for this opportunity and this great session. I'm passing back to our moderators and I believe Malcolm. Thank you.
Thank you very, very much, Jack. A big thank you to all our panelists, from Albert from Cape Town, Dr. Desai from Surat, Jack and Rodrigo from Bayer, and in particular, Dr. Jeanette Ikovics, our partner in the trenches in this program. We really appreciate your interventions and your support, not just right now, but throughout the program. Please watch our website for the session's recording and summary. And stay tuned for our next session on equity and digital and financial innovation, which we'll be hosting in August in partnership with Visa. Thank you all, wherever you are connecting from, and have a wonderful rest of the day or evening. And we hope to see you again soon. Thank you very much.